Welcome to the Let's Talk Health and Care podcast series brought to you by the Integrated Care Academy at UWE Bristol. We'll be diving deep into exciting research and service changes by speaking to the people directly behind them. I'm Peter Brindle. I'm a GP with a real passion for service improvement, health tech and innovation.
And I'm Mark Griffiths, Pro Vice Chancellor and sponsor for the Integrated Care Academy at UWE Bristol. Welcome to Let's Talk Health and Care.
Imagine a world where prosthetic limbs are as affordable as a monthly streaming subscription, where voice-activated switches empower those with speech disabilities to control their environment, and where AI and 3D printing aren't just tech jargon, they're transforming lives and helping people regain their independence. Welcome to Let's Talk Health and Care, where we explore the cutting edge of health innovation.
Today we are thrilled to welcome Dr Appolinaire Etoundi, Senior Lecturer and Researcher in Mechatronics here at the University of the West of England, Bristol. From pioneering low-cost prosthetic legs to developing AI-driven assisted devices, Appolinaire is reshaping how technology intersects with healthcare. Appolinaire, thank you so much for joining us today.
Well, thank you very much, both of you, Peter and Mark, for such a privilege and a pleasure to be with you today. I am absolutely thrilled and excited as well to be sharing a bit of my work, and I would even say my journey, with your listeners and the greater audience today.
So one of the things I've learned by doing this podcast is pretty much every month I discover new words or phrases that I've had absolutely no idea what they mean. And today we've got another one, Mechatronics. I've got no idea what it means. So I'd be very grateful if you could start off by giving me an idiot's guide to what that means and telling us a little bit about your journey of how you ended up doing what you're doing.
Mm-hmm. So Mechatronics is very much a philosophy, as I like to say to my students. It's an approach aiming at bringing in synergy four main fields of engineering. Now, the word itself, mechatronics, comes from mechanics and electronics, but over the years, it has evolved so much, starting all the way in Japan back in the old days, in the 50s, to now become a philosophy, a discipline that brings mechanical, electrical, then automation, which is also control engineering, and computer science, which is, to a certain extent, what we now call AI, because at the root of AI, you have neural networks, you have machine learning, and all of that found these fundamentals from computer science. So all of that is for essentially enhancing a product's functionality. So now you asked me about my journey. As I said, we'll stop there because otherwise I could carry on and tell you how much you basically have mechatronic systems in your washing machine. That's a good example of a mechatronic system.
But, well, perhaps that's another whole podcast.
Yeah, maybe
washing machines.
Washing machine, another podcast. Exactly. Now my journey, as I like to say, my academic journey, I guess, started very much when I was finishing my PhD at the University of Bristol, when I was doing my PhD on bio-inspired robotics, which basically means looking at nature, investigating nature, and conveying what you found in nature with the technology available today. That PhD was about developing bio-inspired knee joint for humanoid robots, because it was heavily on robotics. At that time, I had the luxury to work between the two places, so City Centre and the UWE campus, where the Bristol Robotics Lab was based. And then, right after my PhD, I was blessed at that time to actually be able to secure a lectureship position here at University of West of England. And one day, as I was going to the Bradley Stoke swimming pool, me starting this lectureship and being very much focused on my research that I just did with my PhD, I saw that guy by the swimming pool wearing that prosthetic joint. And me being a very nerdy, noisy and very curious engineer, I said, oh, can I have a look? And he said, yeah, sure. Why are you so interested in prosthetic joints? And I said, well, because I'm actually developing bio-inspired knee joint for humanoid robots at the University of West of England in the Bristol Robotics Lab. And he went, okay, so you make joints for machine then? And I went, yeah, it's kind of similar to what I do, yeah. And then he looked at me straight in the eyes and he said, what about me? And that moment, you see, was to me the reality check and almost like a wake-up call. Not just a wake-up call as it stands, but very much like an orientation and almost like a call for me for the next years of my research, because I thought, hang on a minute, all of that work that I've done in research, I guess could potentially work for someone. Then he challenged me, and then I challenged him back, because I said, okay, well, what are you here for? And he said, well, I'm training for big competition. And I said, well, let's make a deal. You go over there, you win, and if you win, we discuss about research. A few months later, I got a phone call from Andy, and Andy said, you remember me, the guy at the swimming pool? I said, oh yeah. He said, let's go for coffee. We arrived at the coffee place, and on the table was a gold medal. The guy I was spoke to was actually Andy Lewis, MBE, who actually happened to be the Rio Paralympic Games gold medalist. So he said, what do we do now? And I said, well, I think we're going to write a proposal and we're going to try to get some money to do research together, which is what we did. And we were so lucky to receive funding for 2 years and entitling me and giving me the ability to develop the very first bio-inspired prosthetic joint based on his features. So we reconstructed his missing limb based on an MRI scan, X-rays, and that was us trying to help him to win again in Tokyo 2020 Paralympic Games. That's, I believe you know that because of COVID never happened because of the crazy COVID period. But that's the journey.
Wow, I mean, that's just an insight into one person who, that contact point in that swimming pool at that time in the day. But I think what's clear is just your passion for helping others, your curiosity, your drive to connect nature and bio with mechatronics and with rehabilitation in patients as well. It seems to really, really shine through, but also how you work with your students and how you work with fellow researchers and academics across the organisation. Have you got any other kind of broader examples of other colleagues or people that have come into your life?
Yes, absolutely. I mean,
tell us about them.
Yes, I mean, there's Andy, and during that time with Andy, then I ended up speaking with Tanya Goddard, who's a wonderful, marvelous lady that I could also spend hours talking about because she's the one who told me, great, you're doing this wonderful work with Andy, but he will tell that to you himself. The problem that we all have as amputees is not just the prosthetic, it's also the socket.
Yes.
Because one thing that we did was, as she reached out to me, was, okay, we're going to look at her problem from a different perspective. This time, I'm going to monitor her directly. I'm not just going to start by doing some potential simulation of what might happen or what could be happening inside. I'm going to put some sensors inside her socket, and I'm going to ask her to just walk on campus, go up and down the stairs. And what we found was, after an hour and a half of her wearing the socket, the temperature goes all the way up to 47, 50 degrees. Wow. And it's exactly the same as, imagine yourself wearing your shoes, and all of a sudden, after an hour and a half, temperature goes all the way up to, 50 degrees. Bruises, blisters, you name it. All the issues you can imagine. So Tanya helped me to refocus my research on how can we make socket even more breathable, more smarter. How can we make socket that even monitor what's happening live and provide that information to the patients so that they know at what time of the day they may need maybe to remove it, or they may need to even have the actual material of it to even change as well over time. So there was Tanya, then Igor Bukovetsky, who reached out to us when we decided to go for this competition, Sabatlon 2024. We had a great privilege to be on the track with the journalists who were asking us questions about our legs were, because we developed for Igor a full leg for him. So starting from the stump, we used generative AI to develop that particular shape of the socket, which was integrating soft materials, allowing the skin and the liner to actually breathe. Then we used the bio-inspired prosthetic knee joint that we made for Andy. We used the same research to make it for Igor, all the way down to the ankle, allowing him to stand. I remember that day in the lab when he said to me, looked at me and he said, wow, you did it. I actually can stand on my legs. You did it. So, so Igor was one. Then more recently now, I've got Justin. Now, well, he's a bit more challenging because he's a double amputee. But, challenge is my middle name, as I like to say. So we're gonna make something for him as well. He's from the military, so he's a veteran. And he did say to me, what you've got here, the research you're doing here, is something that we need for veterans. We need more of this. And you need to let the world know about your research. Because we're going to need to knock on some doors. We need to go and knock on some doors. Yeah.
It's so powerful, isn't it, Peter?
Can I just ask, so Andy's joint, you actually did make a new joint,
yes,
did you?
We did.
And was he happy with it?
Yes. So
what did it enable him to do that perhaps he wasn't doing before?
Because he's a para triathlete, he's got to go from swimming to cycling and then to running.
All right.
So when it comes to transition time, most of the time what he had to do was to change his joint. So the knee joint that we made for him was allowing him to use it both on his bike and also running. Okay. So a multi-modal prosthetic joint. That's what it was.
So before then he was using one joint for running and then he'd have to change it.
Exactly.
Oh, right.
Exactly.
So it saves him
time. Exactly. And he said to me, if you can reduce the time by even 30%, that's a win guarantee. Yeah. Before going to Tokyo, when he was supposed to be going to Tokyo 2020.
So those are joints and prosthetics.
Yes.
I know you're doing some other stuff, aren't you?
Yes.
On AI-powered voice-activated switches for people with learning disabilities. Tell us more about that. How does that help people's lives?
Yes. So the story started with all those patients that I've mentioned now, actually, they're all coming from the Bristol Centre for Enablement that we have, I would almost say next door because they are in Patchway. So I ended up going over there every now and then to end up meeting people, getting people to ask, I saw you last time, what are you doing here? I said, well, I'm working with this patient and now this patient and now this patient. So getting to know the prosthetist, the word passed on to the director of the centre, so Dave Rowland. And he said, well, I think the time has come. I need to meet that guy. So he ended up making a trip to the Bristol Robotics Lab with St. Joy, which I think is the chief executive of the NHS, I think if I remember correctly. And they ended up going around the BRL and they said, yeah, where is Appolinaires' work? Because we keep on seeing him at the BCE. Where is his work? So we had, me and Dave, an amazing discussion about how much he does want to see research more and more being something that is being undertaken. Because of the service that they are delivering, they can't sometimes afford to do actual research. So he said, well, whatever you're doing, let's find ways we can do research together. So among the things that I decided to explore with him, okay, you're doing research on prosthetics, which is, we need that. But I tell you, we have a lot of other services at the BCE that I'm sure the way your brain works, you could definitely apply some of the mechatronic solutions that you have to other people. So talking with people there, we identified people with speech disabilities, people on a wheelchair that can't communicate or have all sorts of diseases as well. What can they have as a device to at least be able to communicate very simple things? Either something that they want to turn on, turn off, or even speech writing, for example. So we ended up speaking with the speech disability service. Having, as always, amazing encounters with people there. They said, okay, we want you to meet one of our patients so that you can appreciate what she's using. What we then did with them is we ended up setting up a project, which is a 6 months project where we are developing a voice-activated switch for patients. So what it is basically is currently patients are using switches, whether they are mechanical switches or they are voice switches, or even some of them are trying to use eye tracking switches, but these are not very, I would say, reliable. So at the moment, what's on the market is very restrictive and it's quite constrained. So the whole point of the project is developing a very modular platform where whatever patient you are, the BCE clinicians will assess you first to see what is your level of communication. And then using our platform, we'll be able to then say, okay, you can actually use either sound command, or you can use eye control command, or you can use mechanical, or I would say a physical switches command. And all of that will then be going through the platform, which would be then using AI to predict what the patient wants for the day. So that will require a level of understanding what the patient is doing and what are those particular commands that the patient is using. So if it's voice, our model will then learn what those voices commands are and then decide, okay, today it's the morning, do you want to have a cup of coffee? And then the individual will be able to say yes or no. Or if it's maybe at the end of the day, oh, do you want to turn on the TV to watch TV? So this whole platform will be adaptable for the patient. And that's what we're trying to develop now as a proof of concept prototype, which will be as well demonstrated actually at the AI for Good Summit that I'm going to be going in Geneva. Thanks to the great support that you provided here, Mark, I've got to say. I will be presenting part of this project at this AI Summit for Good in Geneva, yes, in July.
So is it like a sort of like a translation device in a way?
So in a way, yes, that's what it is, exactly. It translates your intentions. So before knowing the intentions, you want to first going through a period of understanding what the patient is doing throughout the day, and then determining, okay, you're more likely to be doing this at this time of the day or that.
It's a form of predictive kind of translation, isn't it?
Yes,
in terms of
yes.
It predicts what you're going to do based upon an algorithm that will be built up over time.
That's right. Yes.
I guess there are a lot of people that can benefit from that, aren't there?
Yes,
People who've had strokes, or
exactly.
people with cerebral palsy.
Yes.
There are just many people that struggle to express
But
themselves.
that kind of predictive AI,
Yes.
and how to know how to get into the way of that person's life being played out. Is really powerful. I think it's a real game changer for those, as Peter said, Appolinaire, in terms of who are either struggling with speech. Think about the impact of having a stroke, the impact of dysphagia, and how that can further impact your life. Tracheostomy. So the list goes on. I just think that's such an innovative space that you're in, and I think a testament to you in terms of your work across this mechatronics field, which is a relatively new term. I know you mentioned Japan in the 50s and 60s, but I think in certainly this kind of part of the world, I think we're only beginning to understand really what mechatronics and the philosophy of this is about you excuse the pun, walk us through the process of designing and testing these prosthetic devices. So walk us through the kind of high-level thinking around where do you start with this? And I mean, you gave a beautiful example of meeting someone in a swimming pool, but there must be a framework for this in terms of how you start.
Absolutely. So because it's prosthetics, that means you have to start from the individual. So you start from the needs, comfort, affordability, and functions. Now, bearing in mind that what we want to do is always tailored towards the individual, you want to make everything to be as customizable as possible. So we'll start by taking the measurements of the individual. So 3D scanning. If we can, or sometimes afford MRI scans, we then go even down to MRI scans, X-rays as well. So getting as much information as possible so that we can now, that becomes our baseline to decide on what we're going to be designing for the individual. Now, throughout this process of design, where you will then integrate generative AI when it comes to sockets, because you always start with the socket, which is where the individual stump will be in. So now the jargon is a bit interesting here, because what the patient is wearing is a liner, which looks like a sock. Yeah. And then on top of the liner, you have the socket. So that socket is the rigid part of the prosthetic. And then at the bottom of that, you have then the prosthetic joints, which is essentially the part of the leg that will be mobile, that will allow the individual to move, to locomote. So to go around, go up and down the stairs, or sometimes even jog if you're wearing the particular type of prosthetic joints. Then going further down on the leg, you then have the ankle joint, which is usually fairly fixed. But we are also looking at how can we make that ankle joint to be even smarter. So that's another area of the research that I'm also looking into is, can we make that ankle to be at least responsive to a certain degree that will allow the individual to feel like it's giving the same response as the other remaining leg. Yeah, so socket, prosthetic, and then the ankle. So that's these are the three phases. Now, design-wise, we start with the 3D scanning, as I said, then we go on to designing the actual socket, the prosthetic. Then you have to do then some usually 3D printing, because we want to keep everything low cost as well. So when we went to the Sabathon, when we were asked by the journalist on the big track, oh, how much is this whole leg cost? And we said, well, we're going to beat the market here, and ours is actually less than £500. Wow. And we could hear in the crowd people going, oh. and at that time, we were actually competing against the two big whales of the prosthetic world. One of the guys that I met years ago on this project came at the end and said, so that leg of yours, how come is it so cheap? And I said, well, we're using 3D printing. And he said, is that all 3D printed? And I said, yeah. And he couldn't believe it. He said, okay, here's my card. We need to have a chat together. So, but that's the process, yes. Going all the way from making things affordable, making sure that they are affordable for people. Yeah.
And I guess that's where the product design, that's where the kind of design principle, that's where the CAD comes in.
Yes, yes. All of that, exactly.
So what you mentioned earlier, Appolinaire, about bringing it all together under kind of the umbrella of what does innovation look like, and to do this as cheaply as possible so you can reach as many people. I think that speaks volumes, again, to your type of leadership in terms of making this for the mass market, where you've been impacted by the individuals that you've mentioned, trying to really drive forward that innovation at a really low price base for people.
Interestingly enough, throughout the years of having supervised students, some of the now alumni happen to now be working in companies who are making prosthetics for underdeveloped countries, like in Africa, for example. And one of my ex-students is now in contact with me to tell me about how much the work that he's been doing here at UWE has empowered him to go and work for that company. And now we are back in communication because we want to do work together. How can we make the world of prosthetics more accessible for people who can't afford, I would say, expensive prosthetics? So, yeah.
Sounds very much like that you could end up disrupting the prosthetics industry.
Well, if needs be, I guess.
Well, it sounds like there are the needs, aren't there? Because we've already established there are many, many people that can benefit from the technology,
particularly in certain countries.
And we also know how expensive it is. What do you think the challenges are with disrupting the existing status quo and trying to realise that vision of more affordable prosthetics and mechatronic devices that can help people around the world? People who can't typically afford expensive stuff.
I think what needs to happen is an overall understanding that when it comes to prosthetics, and I think you could ask any amputees, they will confirm, the technology tends to be only affordable for those who have money, because it's usually a high-tech level of device that you're looking at. By default, as I said, there's two big whales here when it comes to the world of prosthetics, who tend to make their prosthetics to be, because they're high-level technology, quite expensive. So with the technology we have access to nowadays, think of, again, 3D printing, smart materials, there is a way we can downgrade that level of technology to make it affordable for people that do not have such resources. And to me, what needs to happen first is, I would say, an understanding coming from, the whole, I would even say, the whole government when it comes to making things accessible for the daily life people, as I call them, the people that I see at the BCE, for example. I see them, when I go there, and I can see the thoughts and the wishes that if only I was not on a wheelchair, if only I could have access to this prosthetic or this prosthetic, because from what I can see from the commercials, it can help me to walk and to jog. So it's really very much looking at what is affordable nowadays for daily people and making such a device, not to be at such a high cost. So looking at, our research centers and allowing researchers to develop the technology that is doable and feasible to make at a lower price.
So is it the technology that is very expensive now and you can envisage cheaper technology, or is there some kind of market that is somewhat reluctant to reduce its prices?
I think it's a bit of both. The people who are developing high technologies, they set the bar, basically. So what needs to happen is startup companies needs to be, and especially I know in the Southwest we are so good at that, empowering startup companies should be given the ability to develop, and then trial their solutions with patients at the BCE, for example. And then on the other side as well, on the NHS side as well, I guess, is allowing this to be, making it more feasible for researchers to have access to patients and to clinicians to help them to develop the technology, which is exactly what I'm trying to do, with the BCE, is walking hand to hand with them and telling them, right, you deal with the people, we deal with the technology. Allow us to trial the technology with your patients under your conditions, because you know best what's safe. We're not safe people, we're engineers. We just like to make things and break things usually. But you can tell us when we are on the line, you see. And then once tested, validated, commissioned the technology, then working with, the economic people to then decide, okay, that can hit that particular market, and then make that technology available for such a market, you see. So that's where I see needs to be a bit of a change of culture.
I think, you've mentioned the Bristol Centre for Enablement a few times, Appolinaire, and I think it's worth giving a special mention to them, because they are an organisation that you do work with closely. As you say, they are local to the university, and again, this I think typifies where the connections with local communities, partnerships, and sometimes it's not about the massive industries, it's actually about the actual centres which are embedded in the patient population, that have specific pathways that really bring us together. And I think that's fantastic. And the same goes then for how we pull through to the local NHS trusts and other wider communities. So just a bit of a point of reference there for sometimes you don't need to go massive into a huge scale company. You can do this stuff with what's happening right on your doorstep, right?
Yeah, exactly. Yeah, I think that's how you change the world, actually. You start locally, and then it goes in spiral eventually.
Start local, think global.
There we go. Yeah.
So I'm just listening to you, and it is inspiring in terms of the way that you are. I think Peter's right. I think the kind of disruption, but in a positive way, because there must be nothing worse than if you are an amputee, it doesn't matter what age of life it is, still the fact that you're an amputee and seeing this technology out of your reach if you can't afford it. And okay, there comes a point where a really expensive prosthetic will do probably a lot more than a low price one, but still to have that ability to actually attach a prosthetic and do the most fundamental of tasks is a life changer. So it's really important. Can I ask about how you're harnessing technologies like 3D printing, AI, and digital twins in your research?
Yeah. So what we call 3D printing, would definitely reduce the prosthetic cost by 80% for sure. Enabling 3D printing, so what we call rapid prototyping and customization, I think to me will be very much the game changer here on a global scale. At the same time, AI is something that I am now tapping into because of mechatronics being such a evolving field, integrating computer science. In that particular project that we are doing in partnership with the BCE, we have that voice switch, which will adapt to user patterns, such as recognizing degrading speech over time. So that will then allow the individual to even I would say evolve with the device itself. So as the AI will predict what's happening, the AI would then be able to even anticipate what are the needs, even if the patient happens to not be in a position to speak anymore. So that to me is also very essential to ensure that the patient can still communicate with the external world. Digital twin is something that I have now been developing over time because of this generative AI design process that we've been developing for Andy, Igor, and hopefully for Justin as well, where it's all about simulating what the patient will be in the virtual reality environment, and then using that data to then make things better for him in simulation. And then after simulation comes obviously validation with prosthetics. Yeah.
So what does the future look like? What's the future for assistive technology?
Yeah,
what are the game changers you're looking forward to? What needs to happen?
Well, I think last time we had this great event that you two organized, I said I had this vision of a center. I think, I will call it a bespoke center with the great stamp of the ICA on it, if needs be, /the BCE and the NHS and whoever wants to be involved, really. But a bespoke center for rehabilitation. So a place where there will be an absolute synergy of clinicians, prosthetists, occupational therapists, engineers, researchers, all of us working together for the good of the patient. So very much looking at how can we tailor prosthetics in real time. So collating, as I said earlier on, data starting from 3D scanning, MRI, X-rays, measurements, data about the weights of the patient, what are their features, and then knowing as well from the individual what they want to do at the end. So knowing what the journey will be like for them. Then when that happens, working then again with clinicians, working on solutions for them, tailored on what their needs are, and then involving them all the way through the process. So I always think of the center where there will be people coming in, we get all the data, and then at the end they go out with a prosthetic that just works for them, and they can just hop and jog and run and then swim and then that's to me is the dream. That's my vision. Obviously, I know for that there needs to be work done together with individuals, and that obviously will require funding. So I do making an appeal here to whoever is keen to give us a hand when it comes to sponsoring this research, either through industry or else. Please do join us, because we need the right people on the table. But we know it's not going to happen overnight, and we need people who can put their hands in the pocket and give us a hand. So yes, definitely, to me that's a vision, a center that can provide solution for people. Yeah.
That's quite a vision, and I believe it's a legacy in the making. So you're looking for collaborators.
Yes.
You're looking for investors.
Mm-hmm.
Yeah.
Yeah.
But I guess like any innovator or entrepreneur, which you definitely are, with the successes, they're often matched by a few challenges and difficulties.
Yeah.
So what are those challenges, and how do you keep motivated through them to keep pushing on?
Yes, I think challenges most of the time end up when you've got that momentum with a great project with individuals, and then the project finishes, and then you're always then on the hunt of finding another pot of funding so that you can carry on with the research. And so challenges, I would say, probably are usually where the fundings are going to come from to help us to carry on doing it. But then what always sparkles and always have me to keep going is when I have testimonies from individuals like Andy, Tanya, Igor, Justin, that says we need more like you. We need that because we feel ignored. And I know that from them firsthand. They've said, especially Tanya, who said, when I'm on my wheelchair, I'm completely disregarded. People don't see me. And she told me a very atrocious story that she had when she went to a shop, and the lady came, and she was obviously with her husband, who was pushing the chair. It was a shop for I think for lingerie, for women, and the lady came straight to them, and she said, "Oh, what can I do for you, sir?" And the husband said, "It's for my wife. She's the one who's going to be buying things from this shop." She said, "I didn't see you." Literally. Although he was pushing her on the wheelchair. So testimony from such a people that says, you're giving me hope. You see, that's what really drives everything. You give me that hope. You give me that little bit of a light. I may not reach it, but at least I can see it. I can see it. And that's to me is the driver. Now, I've got a great privilege as well to work in the university where I have great students here that are doing amazing work. So supervising them, seeing the work they do. I got one recently who has been winning awards here at the university, and he presented the work that he did for a project in 2 universities already. So, seeing that sort of work and thinking, yeah, it's paying off. And it's a privilege for me to see that they they are changing the world in their very own way. And seeing them afterwards as well, students running their own companies or telling me later on, what you taught me is what now makes me to do what I'm doing. I've had students who are now working in the US on projects, and he says, I'm doing mechatronics, I'm solving engineering problems, I am applying what you taught me. Why don't you come and join me? And I said, well, I have others to inspire.
Oh,
so, yeah.
It's been such an inspirational kind of time with you, Appolinaire. We are going to wrap up shortly,
Yes.
but before we do, a couple of points on advice for
Yes.
young researchers
Yes.
or engineers, just reaching out to them who are starting their
Yes.
journey in life.
Yes.
What would you say to them?
What would be my legacy, I guess? What I would love people to sort of embrace is the focus on real user needs. I think, as I said to my students, engineers are problem solvers. So, there are problems out there. We know our world is full of problems. So, as you receive your training, look at the problems, embrace the training that you've received, and then apply it. Apply it in whatever shape or forms. So, talk to patients, talk to clinicians, talk to professionals, experts, and I would say, like the BCE, for example, and meet them where they are. Sometimes go the extra miles and meet them where they are in their needs. Yeah, embrace failure, I mean, as I said to my students, you're not going to get it right the first time. And it's okay. It's okay to be okay with the failure. Because through that failure phases, through the experience that you're gaining, you will then gain wisdom. Wisdom comes from accumulating that experience of not having had it right the first time. And then you move on. But always get back on the horse. Never stay down. Never stay stagnant, because who doesn't move, well, goes backward to me. You see, that's the way I'm seeing it. Collaborating across disciplines. Yes, I mean, mechatronics is by default, this way of thinking of those different fields of engineering. But as I said, you can apply it to your daily life. You can, by collaborating, by going together, we go further. On your own, you can go faster, but together you can go further. That's the way I'm seeing it. And yeah, be also humble to let yourself be inspired by little things. Stay curious, but be humble enough to say, actually, I don't know about this. I didn't know that actually inset guard gears, for example, which I always fascinate my mechanical students, mechanical engineering students when I tell them that. Inset guard gears, we thought we invented them as engineers, we didn't. So keep looking in nature, for example. Go out for a walk and let nature open up your mind to the beauty, and the rest will come. Yeah.
Well, I can see why you inspire your students. I'm feeling pretty inspired. I'd like to join your team, please.
I'm trying, yes.
One of the things that's really, many things have struck me listening to you today, but you are so incredibly user-led, aren't you? Everything you do has come from observing and talking and especially listening,
Yes.
listening to other people. And I think that is... that's an inspiration to people who want to work in any field, particularly the health field. Listen to the people that you'll want to serve. And that, coupled with your vision, is quite phenomenal. So time has flown by as always. So Appolinaire, I want to say a huge thank you for sharing your transformative work and your vision for, I guess, some kind of easy jet of prosthetics, something along those lines.
Yes, exactly along those lines.
Making it feasible.
Yes, affordable.
Feasible and affordable for people that need it but can't access it. So it's just been a great privilege. Thank you for joining us.
No, thank you both. And yes, my great pleasure to have been able to express all of it. I mean, there's always more to say, and I'm definitely open for more conversations like this. So I would invite anybody to come to my lab whenever they've got a chance to, and happy to give them a tour. So, but thank you both for giving me this such a great opportunity.
Merci beaucoup, mon ami.
De rien. À la prochaine, as we say.
Well, I think that's it. So to our listeners, if you are as inspired as we are, don't forget to subscribe to Let's Talk Health and Care on your favourite platform for more stories of great health innovation. Mark, who have we got next time?
Well, without giving away all the details, we've got a summer showcase of local tech entrepreneurs and their game-changing startups. So that's what's happening next. Say no more.
Brilliant. A real feast of innovation awaiting us.
Until then, it's goodbye from me, Mark Griffiths.
And from me, Peter Brindle. Stay healthy and take care.